I want to thank you all for coming, and I especially want to thank our presenters, Pat Victoria from the department, who is the font of all knowledge having to do with your fringe benefits and retirement. If she doesn't know something, it doesn't exist, I can assure you that. We have Natalie Sowersby from Social Security. All of you will either are already on Social Security or will be soon. And if you're not, she'll tell you why you ought to be or why you ought to wait. And then we will have Liz Armstrong from TIAA CREF speaking. The program should be a little more than 2 hours. We may want to take a break. We'll see how it goes. I just want to caution you against asking individual personal kinds of questions. Try to think in more general terms and more global terms about the kind of questions you want to have answered. If you have individual concerns, stay afterwards and talk to one of our presenters, and I'm sure that they would be willing to stick around to help you. Okay? So let's start with Pat Victoria from our own Human Resources Department.
Okay, so today we'll talk about retiree medical benefits. The state has a website, employeebenefits.ri.gov. So if you had any questions about any benefits that you have now as an active employee or in retirement, everything is on that website, so you can go there. But there are three sort of sections of health insurance when you retire. The first part is COBRA, and that is for employees who are under age 65 for the medical. COBRA is an extension of your active medical benefit. So it's the same medical and prescription plan that you have as an active employee. It's also the same dental and vision plan, and the coverage can be up to 18 months. In each one of these sections I will speak about, but this is kind of the summary. So once the 18 months have passed and you're not yet 60... Sure. Okay.
Pat, the house microphone is on the podium.
Okay. I got one on here
That
too.
microphone is just for your recording.
Oh, okay. I'm sorry. Okay. There we go. Okay. Okay. Is that good? Okay. You're welcome. All right. So COBRA is over, the first 18 months in retirement, and then you're not yet 65, so you go on to what's called the early retiree plan, which is the same medical and prescription benefit that you have as an active employee, but no dental or vision coverage. And that plan will last until you turn 65. And then you become eligible for Medicare. And then there are two plans that the state offers that are Medicare related. One is called a Medicare Advantage plan, and the other is called a supplemental plan. And we'll speak about each one of those. So when you first retire, you're eligible for COBRA, which is the medical, dental, and vision benefit that you have right now. It has the same co-pays built into it for prescriptions, the $5, the $20, and the $40 that you have now. The medical portion, which includes the prescription, is only available to someone under age 65. But the dental and vision is still available. That's not age-related, and that can last for up to the 18 months. And spouse or partner is eligible for the same benefits as well. Once you go on to COBRA, you can choose which portion you want. Choose the medical, choose the dental, choose the vision. Whichever part you choose, there's also a 2% state administration charge that is added onto that as well. And these are the prices. Right now, the medical portion of COBRA, which includes prescriptions, is $603.77 a month. $603.77 a month. The dental is $32.73, and the vision is $4.85. So 2% would be added on to each portion, whichever you choose. Now, in retirement, well, let's say as an active employee, the state only offers us an individual or a family plan. But in retirement, most of the time, it's just two individuals. There aren't any dependents on the plan at that point. So the state does allow you to purchase individual dental and vision plans or individual medical dental and vision plans. You don't have to buy it as a family because a family plan is 3 times as expensive as an individual. So you can purchase the individual plans because you're paying for it 100% anyway.
Pat,
Yes.
Your domestic partner was several years younger than you.
Mm-hmm.
And let's say the employee here was old enough to go to full retirement and would need this. Would they break the medical in half for the spouse until he or she became 65?
Yes, well, the medical you would purchase as an individual. That is the price of an individual
Oh,
plan.
okay, good.
Yep.
Thank you.
So these are all individual rates. If you
Okay.
had to buy a family medical, it's about $1,900 a month just for the family medical. Yes, sir.
I have just one question. What if you have a domestic partner that has medical, but you want just the dental and vision?
Yes.
Can you purchase
Yes,
that?
you can. They're individual pieces. Yes, you can purchase them individually. Okay. So after the 18 months of COBRA is over and you're not yet 65, there's a bridge plan called the Early Retiree Plan. And this is obviously the eligibility period between the end of COBRA and Medicare. It's the same medical and prescription coverage, but no dental and vision with this. And right now the cost is $961.40 a month. So at this point, there are exchanges that are available in Rhode Island. The Rhode Island Exchange website is healthsourceri.com. So if someone needed a plan between this time of COBRA ending and Medicare eligibility, it may be worth checking out what's available to you on this exchange as well. I mean, it's a good plan, but it's a lot of money. So you may wish to check out the exchanges too. So now you're eligible for Medicare. So with Medicare, you would also need some type of plan to go along with it to boost the benefits that Medicare would give you. The state has 2. They're both through United Healthcare. One is called Supplemental 65, and the other one is called Medicare Advantage HMO. And the rates for the supplemental are $225.41 a month, and the Advantage plan is $206.94. The difference between a supplemental and an Advantage plan is that a supplemental plan is portable, which means you can take it to any state. There is no network. If a provider or a service is covered by Medicare as your primary insurance, it would be covered by this supplemental plan or any supplemental plan. So it's a national type plan. There's no network of physicians. You can choose any doctor that you want. You don't need any referrals. But it also doesn't include dental, vision, or prescriptions because a supplemental plan boosts up the benefits of what you get through Medicare Part A and B. And Medicare Part A is hospital insurance, and Medicare Part B is medical insurance. So these supplemental plans will only boost up your Part A and B benefits of Medicare. So anything extra you would need to purchase on your own. Yes?
Now, that price for the supplemental and Medicare Advantage plan that's put in the thing, is that in addition to some fee that you're paying?
Yes, and we'll get to that, to your Medicare on the next. So this is just the medical portion of your health insurance. So this is the extra on top of Medicare. Yes?
Can this slide set be available somewhere?
It's in your packet.
Oh, the whole thing is in there?
Yeah.
Okay.
So the other style of health insurance is called an Advantage plan. Advantage plans are network plans sold by state. So with the Advantage plan that the state offers, you have to be a Rhode Island resident. There, you do need a primary care physician. There is a network. United Healthcare kind of tightened up the network that it has. It tightened that up in February, although once they kind of threw everybody out of the network, they kind of accepted people back in, but not everyone. So if this was a plan that you were thinking about choosing, we would check first to make sure that your doctor is in this network. You don't need a referral. As long as the physician is in the Medicare Advantage network with United, you could use this plan.
And with Advantage, at least the state's Advantage plan, there are some wellness benefits added in. There's a small amount of dental, 2 cleanings a year, x-rays. There's 1 vision exam a year, and there is a prescription benefit added to it. So with an Advantage plan, it has the prescription plan built into it, but the supplemental plan does not have a drug plan. The Advantage plan is a network plan, so you're limited to Rhode Island. The supplemental plan is national, so it depends on the style of health insurance that you're looking for. With the state's Advantage plan, they realize that you may not always live in Rhode Island for 12 months out of the year. So if you're a snowbird or go to another state for a number of months, the plan that the state has something built into it called the Passport Service. And that means that United Healthcare has networks all over the country. So if you are going to a place that has a network, you would, first you would call United Healthcare on the card, there's a customer service number, and you would say, I'm going to this zip code. So they'll look to see if you have a network there. They can take you out of the Rhode Island network, put you into the network where you're going. Now you have access to all the doctors in that network. Then you come back to Rhode Island, you call them back and say, I'm back home. They'll take you out of that network, put you back in the regular network. In case of an emergency, you're covered anywhere, even in another country. So both of these plans have out-of-country benefits. You would have to pay for your services on a credit card, but as long as you bring back a detailed receipt, we will submit them to the insurance company and they will reimburse you just like it happened here. Yes?
I heard a horror story about the passport where a person tried to call because they were going and then they were told there wasn't enough, that they couldn't, it was too early to call.
Yeah, you have to kind of do it within a week.
Later, they couldn't get through. I mean, it was just a disaster.
Yeah. You can't call too early. They probably will tell you if you call that you have to do it about a week in advance. But that's their rules, so.
And then it was an emergency, so she thought that was okay, but the emergency room she went to couldn't handle her problem, and when she went to the next emergency room, then they wouldn't cover it.
Oh, boy.
So there were some
Yeah.
problems with that, I think.
Yeah, those are issues we have with United Healthcare. It hasn't been a great problem, but I know that problems do exist. But for the benefits, if your primary care physician is in the network, that's the biggest thing. It's not a bad plan in Rhode Island. It has the benefits built into it for one price. You don't have to do anything else. This is the benefit that has your drug benefit built into it as well as your medical. If you're already 65 when you're going to retire, then you would choose one of these plans, possibly through the state. You don't have to choose these plans, but this is what the state offers. But you can also purchase COBRA dental and vision if you wanted to. So as well, if you are Medicare eligible when you retire, you still will have the ability to purchase your dental and your vision through COBRA for 18 months, and it'll be the same benefit that you had as an active employee.
What
Yes.
about beyond 18 months? Can you just purchase the vision and dental and go with the UHS supplemental?
Yes, you would purchase that on your own.
But I mean, that will go, you could just do that for years? Or
Yes,
beyond?
yep, however you want. If you want to pay for it, they'll give you it. Blue Cross sells their own dental plans. In Rhode Island, Delta Dental is sold by AAA, because Delta Dental only sells to groups, and the group they sell to is AAA. So if you have AAA, you can buy a Delta Dental plan through them, or you could buy it directly through Blue Cross. Just like United Healthcare only sells to groups, but on the outside, AARP is United Healthcare. That's who supports, United Healthcare supports AARP Medical. So.
Let me just.
Sure.
The COBRA fees,
Mm-hmm.
is that only like if you're a URI employee? I'm kind of looking, I'm 68, I've been out of here for a while.
No, COBRA is a direct extension of the active benefits. So you do that right after retirement.
No
Okay.
matter what you're in.
Yes, no matter what your age.
All right.
The only thing that you couldn't do with COBRA is take the medical portion with the prescription benefit if you are eligible for Medicare, but you can take the dental and the vision. So if you're eligible for Medicare, Cobra Medical is not available to you, just the dental and vision is. You would have to go with a Medicare-related health plan for your medical and prescription, but the dental and vision is still available to you through Cobra.
But would your spouse under 65?
Yes,
still be
yep,
Medicare?
it's all individual at that point by age. Yes.
Yeah, I was confused about United Health. Is the the AARP, is that supplemental identical to this supplemental? Cost the same?
Their AARP offers a range of plans. If you go to their benefit schedule A through N, I believe, Plan F with AARP is most similar, just about exactly the same as what our supplemental plan is right now. The cost is cheaper, actually. Depending on your age. How the state works is the state has the same price for the supplemental plan if you retired at 65 or you retired at 95 or 85. It's the same price across the board. With health insurance companies now, the only way that they can rate your policy is by your age. So the earlier you sign up, the cheaper it is. Now it does increase every year. So basically I did one with someone this week. I did a calculation, and the AARP supplemental plan for someone age 65 or 66 is about $142 a month. With the state, it's $225. But if that same person was 10 or 15 years older, it might be about $270 a month or so as compared to $225. So when you come in to talk about this, we'll look to see what the AARP plan would be as compared to what the state plan has. Now, on the supplemental side, because none of this is paid for by the school for you, you're paying 100%, so you have your choice. But this is at least something to use as a comparison. So on the supplemental side, or the Advantage side, Blue Cross has 4 different plans. And the Blue Cross products are called Blue Chip. So if it's a Blue Chip product, that's an Advantage plan. It's a different kind of plan, but they have 4 different plans that they offer, 4 different price ranges. So we would also check that out when you came in as well to compare what the state has as compared to what you would get through Blue Cross. So this isn't your only choice, this is just what the state offers, and it's something to use as a comparison. Any questions about that at all? Yes?
What happens if the state renegotiates and Blue Cross ends up providing health care to employees instead of United Health? What does that do to?
Well, whatever the state offers is what the board would offer. Because right now, we're Board of Governors type employees, under the Board of Governors personnel rules. We're all state employees, but we have different personnel rules. So the medical plan that is offered through the state for URI non-classified employees is the same. They're the same plans that the state offers. So we are able to take advantage of the amount of the number of people in the state's plan to get a good price. You know, the bigger the group, the better the price. If we tried to get a plan for ourselves for the board, it would only be like 500 people or 1,000 people in the plan. The price wouldn't be as good as if we had 65,000 people in the plan. So we kind of go along on the coattails of what the state does in order to take advantage of group pricing.
Okay, just a quick question.
Yes.
I've never lived in Rhode Island, I've only lived in Massachusetts.
Okay.
And therefore I'm a AAA member in Massachusetts. Does that make any difference at all in terms of buy-in?
Well, if you were to buy through the state, the only plan you could get would be the supplemental plan if you were eligible for Medicare. Because
So I can't use the AAA plan?
well, the AAA you could buy for dental if you wanted to.
No, in Massachusetts. Doesn't matter.
If AAA in Massachusetts offers the dental plan, yeah. You could buy a Rhode Island dental plan, but what would happen is your provider would be paid out at Rhode Island rates. You know, every doctor and dentist pretty much negotiate their own rates with health insurance. So if your plan was basically Rhode Island based and you went to a dentist in Massachusetts, if they charged more, they're only going to get reimbursed what a Rhode Island dentist would get, not a Massachusetts rate. Yes?
You were saying that the cost of the Medicare, Medigap plans were age dependent, and that when you're older, it would cost you more than the younger. Now, the Medigap plan that the state offers, does that price change?
It changes, the state changes that plan not every July, but it is a fiscal year plan. They have not changed it in 2 years, but they don't make it in tiers. It's one price across the board. So, I'm sorry, yeah, regardless of age, right. Yeah.
And you can change plans, right? Just every time
Yes.
there's an open plan.
Every open enrollment for retirees is usually the end of October through the middle of November. Those dates are determined by Medicare and possibly Social Security. Natalie will talk to you about that. So when we find out when the dates are, then we will send notices out to all of our retirees that this is the time to make a change if you want to. Now, if you don't live in Rhode Island, we don't have anything else to offer you besides that, the supplemental plan. But if you do live in Rhode Island, you have the choice of the two through the state. So no matter which plan you take, which Medicare eligible plan you take, you still have to have Part A and B of Medicare in place. In 2014, Part B of Medicare costs, the minimum cost is $104.95 per month. I'm sure Natalie will talk to you about how the prices are, so I'm not going to get into that. But the basic charge for Medicare is $104.95 a month, and that is deducted from your Social Security check before you get your check. And your spouse or partner is also eligible for whichever Medicare eligible plan they want to. They're all sold as individuals, so one person could have a supplemental, one person could have an advantage, whatever seems to suit you.
When you say spouse partner is eligible for Part A and B,
I meant it probably should have been on the other slide. I just didn't have room.
but that's only if the spouse or partner is 65, or is
Yes, if your spouse or partner, when they become Medicare eligible, they're also eligible for either of the plans that the state has.
Do you have to be a tenure-track faculty person to,
No,
those of us?
you're eligible to purchase the plan as an employee. Yes.
For the supplemental or the advantage, is that automatically withheld from somewhere on the?
No, I actually bill you for that. So we bill, when someone signs up for a plan, then I bill you on a quarterly basis. Basically, I pay the bills in advance, and then once a quarter, I'll send out your bill for your percentage, whatever percentage you have to pay. The percentages go from 50% to 100%, depending on your years of service. So I believe 10 to 15 years, you would pay 50%. 16 to 19 years, you would pay 30%. 20 to 27 years, you would pay 10%. And then 28 plus years, there's no charge to you for the plan. Yes.
And that's based on the number of years you worked for the Board of Governors?
Yes, in higher ed. So if you worked at RIC or if you worked at CCRI, it still counts. Yes.
We missed that, what that was all about.
The years of service are how many years of service you had in higher ed.
Does it have to do with what?
To do with, yeah.
To do with the percentage of discount that you would get from a medical plan. I'm sorry, that's not you. You're right. I'm sorry, different group, you're right. Forget it, you pay 100%, yeah. I apologize. Too many groups.
Don't worry about it.
Yeah, sorry, my error,
Forget about it.
my error. Sorry. But talk about the billing, you would get billed by the insurance company, not by me. So we'll strike the last 10 minutes. Okay. Any other questions before we stop talking about health insurance? No. Okay. There's one other benefit that you can keep in retirement, and that is if you have life insurance with the state. So your life insurance would be, the basic life insurance is just salary, rounded to the next 1,000. And then you also can take one other times your salary called the supplemental insurance. In retirement, you can only keep the basic. So the supplemental insurance doesn't count once you retire. And then your forms have a frozen value on it. What we have to do is we have to look at the value of your insurance at age 65, and that is called the frozen value. From that point, your insurance value is reduced. At age 65, we would take 76% of the value, down to age 68, 25% of the value. and your value would never reduce past lower than 25% of the value. The price of it is approximately 40 cents per thousand, so that's how we figure out your monthly charge. And the bills are sent to you on an annual basis. I send the bills out around the beginning of December for the coming year. So you pay once a year for your life insurance, if you want to keep it. So I think that's pretty much it for me. It's my phone number. SRP. SRP?
Yeah.
Okay. SRP time, Bruce Sunland time, also known Bruce Sunland time. It stands for Salary Reduction Plan. It is the time when, I think it was 90 and 91, where you worked for 10 days in a pay period, but you got paid for 9, and 1 day a pay period was withheld for future payment. It was the credit union crisis, basically. That program lasted for 29 pay periods, which if you had to do the whole program, not everybody did the whole program, but that is 203 hours. So if you still have your SRP time, and I say still have it because you were able to use it if you went on a sabbatical or a half-paid sabbatical or not a paid leave, you could have used that. But most people still have it. So it's kind of a forced bank account, but you get paid out at your rate of pay today. So it is pretty good. It's a substantial amount of money, and you are paid out for that 2 pay periods after your last paycheck. So you would get your final paycheck. Most people have direct deposit, so if direct deposit would be your last check, then 2 pay periods later, a paper check is cut for the amount of money that you are owed. That check would go back to your department on a payday, and then you can pick that up from your department.
And no other benefits apply to retirees or tuition?
Not for faculty. No. I mean, if you
12-month faculty would get paid for.
12-month faculty would get paid for vacation time on the books. You don't get paid out sick. But if you're a 12-month calendar year faculty member, you accrue vacation time, so you are paid out for that. Academic year faculty do not accrue vacation time, and no faculty get paid out for sick time. So if you're an academic year faculty member, your payout basically would be your SRP time, 2 pay periods after retirement, after your last paycheck. Yes?
Where do you find on your e-campus that the number of hours that you...
It's at your time card. At the top of your time card, it'll say how many hours you have. Also, there's a woman in payroll, Cheryl Glennon, who would be able to just get her hands on that information quickly. Her extension is 5203. That's who I usually recommend for people to call and ask about that.
The payout is approximately 10% of your current salary. So whatever your current salary is, it's approximately 10% of that for your SRP money.
Deb?
If you have SRP and you go on the phase retirement, so you're working at half pay,
Mhm.
half pay, how is that calculated? Is your SRP?
It's still by your hourly pay.
It's the hourly.
Yes.
Your
So it doesn't
hourly
matter.
is the same. Okay.
Yeah, it doesn't matter how many hours you work. It's calculated at your hourly rate.
Okay.
I think we have a different formula for the faculty.
Okay?
Okay, I could get it to you, but it's not based on hours.
Okay.
Okay. Is that in hours on the time card?
It is hours on the time card. You're right. Well, then we'll find out what the payout rate is. Okay. Strike 2. Was there another question in the back?
Same one.
Okay. Yes.
I just wanted to say, as someone who has abused you for so many years and your benefit office and wonderful co-workers, I just wanted to say,
Thank you.
from everyone
Thank you,
here,
Scott. Thank
they are the
you.
most wonderful, helpful, kind people in the world. And I think to show our appreciation, we should pass a resolution that they can't retire.
Yeah. That's usually the first question I get when someone comes, when are you retiring? Thank you very much.
We're especially blessed considering the few resources that they have to work with over there. I just want to go over the packet with
Let me give you this.
There is an evaluation here, and I'm asking please to fill it out before you leave and hand it to Mary outside or to me. It's very important.
Can you do me a big
There's
favor
also
and
in
get
there,
me some water?
you all should have gotten
Look
by
at me
email,
losing my voice.
a copy of Provost DeHaye's phase retirement plan. which will be offered this year in 3 more years. If you want to take advantage of it, basically you'll have to decide if you want to have 1 semester on, 1 semester off, or if you want to have a whole year at halftime. You have to develop a plan, which now can include teaching, research, and service. It's not just a teaching plan. So you can develop a plan for all of those things.
This is the one that's driving the whole room. This one and these are just mine for my camera, so they don't do anything for the public address.
Oh, we didn't understand that.
So when the people,
This year I've
this
been
is the top
told
page,
very
that's
few
the
people
one.
have
Is it
taken
a-
it.
If you want to take it off, you can.
I like it like
I
this.
think so too. You
By
can hands free.
Cliff Cat, so I don't know what's going on. So you'll have that, and again, please look at the evaluation plan. And one more thing about what Pat said, you know, it used to be that our plans were as good as you're gonna get anywhere. I would recommend that you look around. You may find something better in the private market. Look at Blue Cross, look at Humana, look at a number of plans. Pat informed you that earlier this year that that United Healthcare threw out a bunch of doctors, and without informing anybody, they just eliminated them. And that meant that a lot of people and our retirees were without doctors that they had been with for a number of years. The reason for that, I believe, is because under the Affordable Care Act, Medicare Advantage plans are not going to be funded as generously as they have been funded. And so the insurance companies are looking for ways to prevent even more losses. I know in New Haven, for example, where I live, if you're not part of Milford Hospital, if your doctor is not part of Milford Hospital, nobody goes to Milford Hospital. United has dropped your doctors. So I think that's something you need to be concerned about. And you need to, when you decide on what plan you're going to take, you need to make sure that the doctors that you love are covered by that plan, because they may not be anymore, all right? It's a different world than the active plan, all right? So write down the names of your doctors that you want to keep, and try to find out from United or from whatever insurance you're interested in whether they're still covered by their plan before you leap into them. And that's pretty easy to find out. But I'm telling you that last year a number of your colleagues, your retired colleagues, were stunned to find out that their doctors were thrown out by United. So a word to the wise, as they say. Okay. Now our good friends at Social Security. You know, Social Security is probably the most efficient government program in the history of our country. Despite what you may hear from the Tea Party and others, well, it's true. I mean, there's no better government agency than Social Security. Their administrative costs are next to nothing. If you've ever dealt with them, they're fabulous. I mean, I did everything online when I enrolled for my benefits and for Medicare. It is simple. You need to talk to a human being. That's easy to do too. So I'm a big fan of Social Security. It's a great program in our country. So Natalie, where are you?
Can you hear me? Oh. Hi, thank you so much. My name's Natalie Sorsby. I'm the Public Affairs Specialist for the Social Security Administration. I've been with Social Security since 1982. So I have a lot of experience taking all different types of claims and answering lots of questions. My role now is to go around and try to do as much outreach as possible to inform people about all the different benefits that Social Security provides. One of the biggest misconceptions is that Social Security is just about retirement, and that's not true. We have many other benefits that fall under the programs in Social Security. And I'm going to give you an example just by showing you how many different claims we can take just when you file a simple retirement application, okay? It's like a tree. It just keeps growing, and you're going to see how a simple retirement can grow into a lot more benefits. I want to ask you all a question. How many of you here know your amounts, what you would get for retirement. How many of you here know where your last Social Security statement is? Very good. And you've really checked it out pretty well, and you could tell me if you have any earnings missing, if your information's all correct, your name, your date of birth. And the reason I mention that is because we are no longer going to be sending out those Social Security statements in the mail. All of you today coming in probably took a sheet of paper, a fact sheet that said, create an online account, to create a My Social Security account. And that's important. My Social Security, how to create an online account. And I'm going to explain to you why this is so important to you. First of all, we're not going to be sending out those statements anymore in the mail. So if you want to keep track of your earnings, you want to make sure your information is correct, or if you want to create an account to block access from someone else touching your information, that's also very important. Now, if you could just take this sheet for me. On socialsecurity.gov, which is very valuable, and thank goodness we've created this great tool, there are so many resources that you can use to help you determine when you should retire, because it's not an easy decision. And as every individual here, as you get closer and closer to retirement, you're going to start thinking about it, and you'll start worrying, and oh, I don't know if it's too soon. And you know, we've all said we can't wait for that day to come, but when it does get closer, you really are a little hesitant. You're not sure, oh, your number's correct. What am I going to get? What's going to happen with my insurance? Am I retiring too soon? Am I going to be able to have Medicare? Do I file online? Do I go into an office? So much to consider. And it's just a piece of the pie. Like I said, you have to have other savings, investments. You cannot just rely upon Social Security for your only income when you retire. And I know many of you here already know that. But what Social Security has put on our website is really valuable, and you should check it out, or please consider creating a MySSA account. Your online account gives you access to all of your information that's just about you. And you go onto the website and you would hit My Social Security and create an account. Now, I have been promoting this for the last few years, and I have been contacted by many individuals who, when they went to go create an account, it told them that there was a problem. Now, what would be some of the problems? Well, one, some people were typing the wrong Social Security number. That's pretty basic. But two, they were typing the wrong name. They were typing, maybe they were married and divorced, and they never changed their name with Social Security, and they were typing the wrong name. Another problem that has come up quite often is the wrong date of birth. Now, how do we get the date of birth? When you first got your first Social Security card, the date of birth that we were given at that time is the date of birth that we have on file. Now, I have to tell you, many parents gave the wrong date of birth, all right? And you've been using the wrong date of birth because for some reason or another, when they picked up that birth abstract, okay, or they got the wrong date on it, they couldn't afford or didn't have the time to go back and get a new one. So they needed that Social Security number. They went in, they said, yes, this is their date of birth, my child's date of birth, and we're going to celebrate it on another day with them. That's the way it is. So now when you come in to see us to file benefits and we say, you know, this is what we have on record for your date of birth, and you look at us puzzled like, where the heck did you get that date? That's where we got that date. And that happens quite often, I must tell you, quite often. I've surprised people that they're either a lot younger or a lot older, okay? So this also allows you to see, so if you were to go in, it also allows you to see if we have the right information. It would tell you to contact Social Security, you would come in with an ID, and then we would tell you what isn't matching, and we would help you to create an account. But if you do it from home, if you try to create a MySSA account from your office, or from home, or anywhere you are that you have a laptop, how do we know at Social Security that it's you, right? How do we know that it's you doing this on this computer? There are going to be specific questions that you're going to be asked that only you should know, all right? And where do these questions come from? Not just from the thin air. They come from the credit bureau, okay? So there will be certain questions that you will be asked. You have to pick A, B, or C, and those questions are coming from your credit bureau, all right? And this just shows up on your credit bureau as a soft inquiry. This doesn't affect your rating in any way or do anything. However, if you have ever put a block, a freeze on your credit rating, okay, you cannot create a MySSA account until you take off the block. All right? Now, yes.
What if Social Security name is an alias?
If it is, it has to match what is on the Social Security card. To create a MySSA account, it has to match what is on your Social Security card.
You have it changed?
A what, please?
You have to have it changed?
You would. You would. You would, whatever's on,
Still hold, but you still have the new name.
right. It has to be whatever, when you go to create, when you type in your name, it has to be what's on your Social Security card. But there again, many people get married, get divorced, get remarried, get divorced, get remarried, get divorced, and I don't even think they can remember their name by the time they go to do this. And I'm joking with you because I'm going to show you an example of how this does happen. You know, I haven't stayed there for 32 years because it's a boring job. You know, it gets pretty interesting in that office. And when I tell you some of the things that I deal with on a daily basis, you're going to completely understand where I'm coming from. Okay? Now, you have to have a valid email address. You have to have a valid Social Security number, right? That would help. And a valid U.S. mailing address, and be at least 18 years of age. Now, last night I was watching the news and I saw something on the news about Social Security numbers were used to file taxes, and the people weren't getting their tax returns back and things like that. I have no idea how something like that could have happened, but all I can say to you is this is why this tool is more and more valuable than ever. If you don't want to use it to get the estimates or do the changes online that you can do once you're collecting, at least create it to block access to your information, okay? Very, very important. But once you go on socialsecurity.gov, you would hit create an account. And obviously, because I don't have a live number, I could not show you the entire thing, but I will go over it with you. And it's going to tell you that the questions are going to be coming from the credit bureau and that you agree with the terms of service, and then you would hit next. Now, I've had a lot of people come visit me getting all frustrated saying they tried to create an account, and when they come into the office and they sit down calmly with me and we go over it, sometimes it's just something so silly. I hate creating some of those passwords. Don't you hate when it says, time to change your password, and you have to come up with 8 digits and a letter and a symbol and all this good stuff, and you think you hit the right thing, and then you go to hit it, and it's not. You have to, so I tell people, I help them through it, and then they end up doing fine, and they create their account. But once you create your account, what's wonderful, you're going to get to see all your earnings. Now, you think because you get that cute little W-2 form in the mail, right, that Social Security has the correct information. Don't be naive. That's not true. You have to check. There are companies for many of the individuals, and I've taken thousands and thousands and thousands of retirement applications, okay, that I would tell somebody they had years missing. I'd ask them, were you home from 1980 to 82, or were you home from 90 to 91, because it shows no earnings, and all the other years it showed the person was working. They were like, of course I've been working, Natalie. What are you talking about? I go, well, there's no years, no earnings posted for those years. I go, do you have the W-2 form at home? If you do, bring it in. We'll give you credit for those earnings. One lady I met at an event last week, she says, I have 6 years missing. Oh, I can't believe it, I'm out 6 years. I'm like, what? You're not gonna be out 6 years. You have to find those W-2 forms, or we'll write to the employer. Why would you give up 6 years of your work, right? Because how we determine your payments, what we're going to give you someday, is based on what you've paid into Social Security, right? And you've worked hard. Why are you going to gyp yourself? So you want to check and make sure that that information is posted. How many people here are already collecting benefits? If you are already collecting benefits and you create a MySSA account, you can change your address online, you can change your direct deposit online, you can see your payments, how they're being sent out to you, you can get an entire sheet. And also, by creating an account online, if you ever have to show proof of your income from Social Security somewhere, you can do that by creating an account online and printing it right from home or your office. We no longer are going to be giving out the proof of income in the local offices. The only way people can obtain that information is by calling the 1-800 number. 1-800-772-1213, open from 7 to 7. Now maybe you've never needed it, but maybe your mother, father, grandparents, aunt, uncle have needed to show proof of income for rent, for electricity, for heating assistance, for condo fees, anything like that. We no longer will be giving those out in the local office. Okay? This is to keep up with the demands that we do not have the staff that we used to have. Okay? So people will have to either create a MySSA account or call the 1-800 number. So, let's get to the good stuff. How many of you know, you all told me you had your statements, you all looked at it. How many of you know off the top of your head what your full retirement age is? You all know, right? I don't believe you, but you look like a nice group, but I don't believe you. Okay? Now, likely story. Okay. The thing is, I know all of you here know that you at least need what we call 40 quarters of coverage to get a retirement benefit. And that's around 10 years of work. Now, if I had $1 for every time someone asked me if they could buy a quarter, I would be a very rich woman. And this doesn't work like Wheel of Fortune. Could I buy an A? Could I buy a B? Could I buy a quarter? Doesn't work that way. You have to pay into Social Security in order to gain those quarters. And this year, in order to earn 1 quarter, you have to earn at least $1,200. Okay? You can't earn more than 4 quarters in 1 year. You need 40 of them to retire. Now you can make all that money in January to earn your 4 quarters, that's fine. But you can't come in and say, I only have 39, Natalie, could I buy one for $1,200? It does not work that way. It sounds funny and like it's not something that would even happen, but it does. It does happen all the time. I told you, 32 years, very interesting job. Now, as it was mentioned earlier, and it was nice to hear, you know, how you like Social Security and how Social Security helps so many people. Again, people always call me and say, Natalie, when is the earliest I can retire? Has that changed? Has the age gone up? No, the earliest point that you can retire still is age 62. However, please remember this. You cannot file a year in advance. You cannot file 6 months in advance. It serves no purpose. The reason is because you have to be at least 62 for an entire month before you can even get a payment. So if my birthday happened to be May 15th, that I was turning 62, and I hope you all know that I'm not turning 62 May 15th, but if I was, the earliest point, the first full month that I'm 62 is June, correct? So my first check would be in July, okay? Because you have to be 62 for the entire month. Now, our retirement claims can be done on the internet, which is quite simple, or you can make an appointment with our 1-800 number to have your retirement claim done over the phone. You can do it right from the comfort of your home, or if you prefer to sit down in an office, you still make the appointment to do the retirement claim in any local office, all right? So 62, what do you have to think about when you're 62? And if you decide to take it then? Well, if you take it at age 62, you are taking it at the earliest point possible. So that is going to be the lowest amount that you're going to receive, right? At 62. And it is going to be a permanent reduction. The only thing that will change that amount is if you get a cost of living raise, right? Or if you decide to go to work part-time and the money that you earned helps increase your benefit. Now, what is she talking about, increasing my benefit? Well, how do we calculate your payment? I gave you a little sheet of paper that says, a fact sheet out there, that says how your retirement benefit is figured. Now, you can sit home and go over all that or go over the website, and there's a nice little explanation of it, but I'm going to give you the quick part. What we do is we take the highest 35 years of earnings, average monthly earnings, and we index them, okay? Now, what if you do not have 35 years of work under Social Security? We go in and we replace those years with zeros, all right? Now, if you're retired and you're collecting your Social Security benefit and you decide to be a consultant here at URI or work part-time somewhere else, once you get your W-2 form and the IRS lets us know what you earned, we automatically go in and do a recomputation of your benefit. Any year that's lower than what you earned, we will replace it, or if you have a 0 year, okay? Now, when you go to file for retirement, the questions are very basic, but you're going to see how things get tricky for some people. And you're going to chuckle a little bit, I promise you. Okay, it starts off pretty basic. What's your name? Your date of birth? Your Social Security number? Your address, your mailing address, okay? And you are required to provide information to get direct deposit. We would need the routing number from the bank, the checking or savings number. Now we're going to ask you, are you working? Seems simple enough question, right? Some people don't really know how to answer that. Are you working? Are you going to continue to work? Now, the good part about it is you're always allowed to change your mind later on. Let's say you came in today and you said, no, Natalie, this is it. I'm turning 62 in May and I am no longer working. I am not going to go back to work. I say, well, congratulations, enjoy your retirement with good health, but I just want to review something with you. If you did decide to go back to work, Congress determines every year how much you can earn while you're collecting your Social Security benefit while you're under full retirement age. They come up with a figure every year. This year, if you were under your full retirement age and collecting your Social Security benefit, you could not earn more than $15,480 a year and collect all your Social Security checks. That's only $15,480, okay? But the moment you become full retirement age, We don't care how much money you make. You can make as whatever you like. There's no limit on your earnings, okay? So this individual says to me, I'm going to retire in May. And I say, are you going to continue to work? No, I'm not. They're going to start to get their check, I told you, in July, right? Because they weren't 62 for an entire month until June. First check comes in July, direct deposit. Now, there's also a question on there that's going, I have to ask this person, are you married? Seems like a tricky question at times, but are you married? Are you currently married? Were you previously married? Were you ever divorced? Now, the gentleman in the house, please listen up to this part, okay? This has happened quite often in my career. Lovely couple comes in, they sit down, husband's going to retire, wife's on the side of them, they're so happy and everything. This day has finally arrived. We ask the husband, well, are you currently married? He says, yes, this is my wife right here. He tells me her name and this and that. And then I ask him, what is her date of birth? And he starts to get red and he starts to sweat. And then I say, what is the date of your marriage? He starts to sweat even more and he gets all nervous. Now he can't remember when or where he was married. Then I say to him, were you previously married? And he says, yes, I was. And he tells me the name of the person, and I ask her for her date of birth, date of marriage, and he knows all the dates. Well, things took a turn after that. Things took a turn. So my advice is, if you have more than one marriage, write them down on a piece of paper, write all the names of the spouses, their date of birth, their date of marriage, date of divorce, or if the person passed away, because we're going to ask you, who are you currently married to? So let's make believe Elizabeth Taylor comes in to see me. And I say to her, are you currently married? And she'd say, well, I don't know. What week is it, right? No, only kidding. Okay, so we would ask her, current marriage, then the marriage prior to that, and the marriage prior to that, and the marriage prior to that. The date it began, the date it ended, and how it ended. Did it end in because of divorce, or did it end because the spouse passed away? And hopefully it didn't end because you killed the spouse. Because we do not pay benefits while anything is in limbo like that. People, we get these things, again, 32 years. It's been interesting. So we ask about all of these spouses. Okay, we get through that section. Now we ask, do you have any disabled adult children who became disabled before the age of 22? Now, there are a lot of families out there who, when they go to retire, their child was disabled since birth and now is a grown adult living with them, but has been on disability. Probably on SSI because they've never worked due to their disability, and that's what they qualified for at age 18. But the SSI program, when someone is collecting SSI, that program, the funds that create that program are federal and state funds. And the law is, when you're on SSI, you have to apply for any benefit that you're eligible for. So now mom and dad come in and they retire and they say, yes, I have a disabled adult child. He or she's been disabled since they were young, been collecting. Now we have to take an application. We don't have to prove disability because we know the child's disabled. We adopt that decision, but we have to take an application under the parent's record, and 90% of the time they get a lot more money collecting benefits under mom or dad's record, okay? So that's another thing. Another thing we ask is, were you ever in the military service? Were you ever in the active military service? And we would need to know what branch of service, date of entry, date of discharge, okay? That's all things that are going to be asked in the retirement application. Another very important question that comes up right away after that is, are you going to collect a pension from the city, state, or federal government. City, state, or federal government. I am not talking about a private pension. I'm not talking about a 401k or a thrift, anything like that, or a Roth account. I am talking about a city, state, or federal pension. And some of you might fall under that category. And if you have, the reason we need to know if you're going to collect a pension from the city, state, or federal government is because, you know, on that statement you all told me that you looked at, those statements don't consider that you might collect a pension from the city, state, or federal government, because now your Social Security amount could possibly be reduced. It's called the windfall elimination provision. I know you've heard of it. It's no secret. It's been around. I'm glad nobody threw anything at me. But it's called the windfall elimination provision. The way we determine how much your Social Security benefit is going to be reduced is based on how many years of substantial earnings you have under Social Security. Let me give you an example. I'm a civil service employee. I also worked under Social Security, worked 2 jobs for a long time, and I got my little sheet of paper in the mail saying that I was going to get a certain amount from Social Security. But when I retire from Social Security someday, I am not going to get the full amount because I do not have 30 or more years of substantial earnings under Social Security. All right? I will only get anyone who has 20 or less years of substantial earnings will only get 40% of their Social Security. Now, how do you find out what years are substantial? You could go right onto our website on socialsecurity.gov. Please type in windfall elimination provision. It will come up with the chart and all the years, and it will tell you what you had to make in that year for Social Security to count as substantial years of earnings. For an example, this year I think if I was working 2 jobs, my Social Security job, I would have had to make $20,000 for it to be at least considered substantial earnings. So you know, you see a lot of firefighters, right? School teachers, they work 2 jobs, but that job under Social Security, they might have only earned $5,000, $6,000. That's not going to be considered substantial earnings, so you could count how many years you have. Okay? So that's one question. Another thing, now this is still a 62-year-old who told me that they are not going to go back to work. Okay? But what if, after the claim was processed, that 62-year-old was contacted by a former employer or someone else to work part-time? They are going to check on the website and see for that year what is the allowable that they can earn. And usually it goes up every year. Like I said, $15,480. And that would be from January to December. They continue to work. It may increase their benefit. The moment they turn full retirement age, we don't care. Make whatever you want. There's no limit. But that same 62-year-old now is turning age 65. A few months before that person turns 65, they're going to receive a yellow envelope in the mail. I shouldn't say it's going to be yellow. Who knows what it could be by then, but an envelope in the mail with the red, white, and blue card inside, and that's the person's Medicare card. Now, the person may open that envelope and say, "That's silly, Natalie. I told her my husband was working. I didn't want Medicare." Well, when you come in at 62, we don't know what can happen from 62 to 65. So you get that information a few months before you turn 65 so you can determine the proper time if you need that insurance. Now, you may be part of a couple where you're retired and your spouse is working and has coverage for you, so you wouldn't need the Medicare, right? But on that card, it has your name, your Social Security number with the letter A, and that's because you're collecting on your own record. That's all that Social Security number and the letter A on your own. Then it says hospital insurance Part A, and it has an effective date, not the date it ends, because people come in. You already sent me an old card. It says 4/2014. No, that's when it's going to start. That date on the side, hospital Part A and a date. Then medical Part B and a date. Those are the effective dates it begins. Now, if you're part of a couple and you don't need that Part B because you do not pay for the Part A. The Part A is, you paid through the years, you paid a lot of taxes for the Part A, but you don't have a monthly deduction for it. The Part B, you pay a monthly premium for it, okay? And that monthly premium would come right out of your Social Security check if you decided that you needed the Part B at that time. But if you were part of a couple and your spouse had insurance, why should you pay $104.95 a month, right? When your spouse has coverage. So you would send the card back. There would be an envelope that you would send the card back and you would refuse Part B. Okay? A few weeks later, you get a new card in the mail that says Part A only. Follow me so far? But now, what happens when your spouse stops working? And you now are like, boy, I need that Part B, right? I told them I didn't want it. What's going to happen? Can I still get that Part B? Well, yes, you can, as long as you do things the right way. Now, listen up here. Please listen up here. The moment your spouse has coverage for you, right, either stops working or their employer says they're no longer going to cover you, you have 8 months in which to contact us to get on to the Part B without a penalty. This is called a special enrollment provision. What would happen the moment your husband or wife says, I'm no longer working, you're not going to have coverage, you're going to pick up that phone, you're going to call that 1-800 number, and you're going to ask them to send you the 2 forms to enroll in Part B under the special enrollment provision. One form is going to go to the benefits person here, and they're going to write down that, yes, coverage was going on all this time, the last date, because you have to prove that there was no break. And then the other form is just for you to sign and saying when you want it to be effective. Then those 2 forms will come back to Social Security, and we will enroll you in the Part B without a penalty. And you will start having your monthly Part B deducted out of your Social Security check. Now, what if you're one of these silly people who's feeling pretty healthy and are like, you know what, we don't need the Part B right now. Let's see, I've been feeling good. I haven't gone to the doctor in so long. I'm going to wait, okay? Now, do you really think this doesn't happen? Okay, now, all of a sudden, it's 2 years later, you're like not feeling that great, or somebody tells you about a special plan out there, but you need the Part B of Medicare. Okay, to enroll in that plan. Now you come strolling into Social Security and you're like, I would like Part B. I want it right now. Please sign me up. Doesn't work that way. Now the only time you could do that would be during our general enrollment, which is January, February, or March, okay, but becomes effective in July of that year. Plus, bad news. You pay 10% more for every year that you waited. 10% surcharge on top of that monthly premium. So it's foolish to do that to yourself. The moment your spouse, spouse stops working, or the employer no longer wishes to cover your spouse, it's whatever event happens first, you have 8 months to contact us. We'll enroll you under the special enrollment provision. Your employer may turn around and say, we're stopping your insurance 4 months from now. But you get the paperwork all going, and on the paperwork that we're going to enroll you in, we're not going to start it up until they're done. So you don't get charged in both places. Okay? So just remember that. Now that's a simple retirement application. But this is where it gets a little fun. How many of you ever watch the program Leave It to Beaver? Did you ever see that show? I used to watch that show. I'm showing my age, but that's okay. I used to love that program. I never really quite figured out where Ward Cleaver went every day, but he went out in his suit, he was working. Maybe he was working at a college, university, who knows. Okay, but Ward Cleaver retired, okay? He is 65 years old. Ward and I had a good chat. And Ward, I did his application, and he came in with the lovely June Cleaver. They didn't go on the internet. I was very disappointed. But June Cleaver, do you guys remember her with her lovely pearls and everything? Well, there she was, okay? So I told Mr. Cleaver that I was going to pay him $1,200 at age 65. And I asked Mr. Cleaver if he was married, and he said, yes, this is my lovely wife, June. He knew her date of birth, her date of marriage, where they were married. There were no other marriages, no disabled children. Pretty simple. But Mrs. Cleaver never worked under Social Security. She never paid into Social Security. She had to stay home with who? The beaver and Wally, right? Wally and the beaver. So she didn't work. She didn't have those 40 quarters so she could collect. But when I did the application, I mentioned to them that Mrs. Cleaver was entitled to what we call spouse's benefits. Okay? Now, she's also 65. Because she's 65, and that was her full retirement age for both of them, she is entitled to half of his amount. Now, at first, she was startled. She thought that I was going to take half off his check and give half to him and half to her. No, that doesn't work that way. He's going to receive his $1,200, and she's going to receive $600 a month, okay, for being the current spouse of Mr. Cleaver, and she is full retirement age. That's the key thing you have to remember. Full. You never get half unless you're full retirement age. Now, another example. What if, however, Mrs. Cleaver did work? What if she did have her 40 quarters, but she didn't work a lot? And on her Social Security statement, it said at age 65 was her full retirement age, and she would receive $300 a month. Is $300 a month less than what I can pay her from her husband? Yes. So I'm going to do 2 applications. So a simple retirement for Mr. Cleaver turned out in an application for him, and it turned out for 2 applications for her, because I'm going to pay her $300 on her own and $300 from him. Do you follow me? Great. What if Mrs. Cleaver worked and her own at 65 said she was going to receive $800 a month? Could I pay her anything from her husband? No. Okay? So these are the things we look at. Now, that's my nice little simple Leave It to Beaver interview. But every once in a while, I get my crazy Jerry Springer Beyond interviews. And I'm only telling you this so you can, this is really crazy dry material, right? Pretty boring. But for you to remember, you're never going to forget some of the crazy silliness I told you. I guarantee it. Now, if I had asked Mr. Cleaver if he was previously married, fine, and he told me he was, and he was divorced, and then he married Mrs. Cleaver. But I noticed that his previous marriage, the years he was married for at least 10 years. That divorced spouse could possibly also be entitled under Mr. Cleaver's record. And that does not change his current wife's amount in any way, okay? Of course, the former spouse, his former spouse can't be currently married, okay? But let's say she wasn't, and she was 65, and the next day she walks into the office and says, gee, I heard my ex-husband retired, and he made a lot more money than I do. And they whisper this stuff to me at the counter, like it matters. You know, I know he retired. Don't let anybody see me, but I think he's going to retire. I don't even know if he's alive or dead. I don't know what happened, but can you check it? It's fine to check. It's fine to call the office and find out about all these benefits under current spouse, ex-spouse, maybe future spouse, whatever. It's fine. That's when you should do this stuff, not when things happen and there's an emergency and you're not sure what you're going to collect. You want to know these things way in advance. So what we're actually obligated to do at Social Security is to try to locate that divorced spouse. If she's not collecting, to let her know that she's entitled to collect benefits, okay? And if she wasn't currently married, wanted to retire, she could file under Mr. Cleaver's, and June Cleaver could also receive benefits. Yes, sir.
Yeah, back to June and Ward.
Okay.
What if Mrs. June is less than 65, but is 62, and has worked some, but is not enough to make more than half her husband's benefit? Can she take her own at 62 and then switch to?
Right, but it would be reduced by the number of months. The question is, what if Mrs. Cleaver was 62 when she came in, Mr. Cleaver 65, Mrs. Cleaver had worked enough, had 40 quarters. I said she was going to get $300 at 65. She won't get $300 at 62. She'll get a reduced rate. She decides to take her own. But ACI, unexpectedly, different crazy things go on. You would be surprised. You would be surprised. Or we get situations where people come in to file for retirement and they tell me that they have minor children. I forgot to mention that. Not only disabled, but if you have minor children and you file for retirement, God bless you, first of all, but your children will be able to collect benefits through high school. Okay? Now, you all told me you saw those statements, so now you know if you have enough to cover the family members. Do you know what's getting more and more popular than ever out there? Is grandparents adopting their grandchildren. Okay? I had a story, the lady told me, daughter dropped off the child, never came back. And so be very careful when you babysit, okay? You know, be very, very careful. So the thing is, she ended up adopting this child, and when she went to retire, the child was able to collect benefits under her record. Okay? Yes, sir.
Yeah, while you're on that topic, I want to back up just
okay.
It was the issue of collecting Social Security and disabled individuals, disabled children. Let's say I'm collecting Social Security and I become a legal guardian for an individual.
Mm-hmm.
Is that individual able to collect Social Security?
Not as a legal guardian, as adoption, under adoption. Right.
Not legal guardian.
Legal guardian allows you to make the decisions for the individual. Yes, sir.
I retired at 66, and my wife was also 66, but continues to work.
What, please? You both continue to work? Okay.
No, she does.
He doesn't.
Okay.
Can she still get the spousal benefit?
Okay. The thing is, if she's full retirement age, I said when you're full retirement age, you can make whatever you want, right? She can file. We will look at her full retirement age amount, and we will see, is it less than half of yours? And then we will tell her the calculations, okay? But yes, sir, yeah, if it's advantageous to her to do, yes. Okay? Now, 1 second. The earliest point, again, is 62. I want you all to do me a favor, please, and take your retirement booklet and open to page 6. I know I'm running a little over here.
Take your time.
Am I okay?
Yeah, you're fine.
Over on page 6, I know you all told me what your full retirement age is, but please look at that chart. Do you notice 1960 or later, it's age 67, okay? Now, if an individual waits from 67 to age 70, they get what we call delayed retirement credits. You get 8% more for each year that you waited. And after age 70, there's no other increase onto that. Okay, it's called delayed retirement credits. There are people that come in who were widowed, obviously, so worried, not knowing their information. They come in, they sit down with us, and when we say to them, you are not entitled to get widow's benefits until age what? How old do you have to be to get widow's benefits from Social Security? 60 years old. You have to be at least age 60. Now, do most 60-year-olds have insurance that they can just quit their job and maybe afford? Some do, but a lot don't. But at age 60, can you still work and collect widow's benefits? Because you're a widow, we're going to say, you can work all you want, dear, because you're really going to need that income and collect your Social Security benefit. No. You still are required to file the regulations that determine how under full retirement age you have to stick to a certain limit. So a 60-year-old widow, 61-year-old widow would have to still stay under the $15,480. However, a widow who comes in who has minor children, those children could collect benefits through high school, okay? And then when she's 60, she could come in, maybe file for widow's benefits if she could afford it. Or when she's 62, she can file for either her own retirement or she could file under the widow's record. We would look to see whatever was higher. It's higher when the payment, I don't know how to say this in a nice way, but the payment is higher when the person's deceased, okay? They're worth more when they're deceased, okay? It's higher. Now, it makes sense because you're losing an entire income, correct? Right? So you're going to get a higher percentage. Now, if both of you are collecting your lovely little Social Security checks and somebody unexpectedly passes away, if Ward Cleaver passed away and now Ward and June are 67, okay? What is June going to be entitled to? Is she going to still be entitled to Ward's check and her check? No. We're going to stop hers, and she's going to get the highest one. You technically still get your own, and then the difference from the spouse, okay? So it would just be one. I've had people argue with me that they're still going to get the two. And we also do a one-time lump sum death payment only to a surviving spouse, and that's only for $255, okay, to pay for the coffee at the funeral. That's about it, okay? $255. Not too much money to play with. You know, because I feel really bad. I feel really bad when I get a call from a young adult whose mother or father passed away, and you know, they're taking on all the costs of the funeral and everything, and they heard about this one-time lump sum payment, but it's not paid to a child. It's not paid to them. It's only paid to, so whoever passes away first, the next person gets it. I don't care. You can pass away first and have the $255. I don't care. I don't want that $255, right? I want to be living. The bottom line is, how do you find out all this information? You know, you heard it all here, you've been to other things, or you may see things on the news. You have to go and sit down and go on the computer and look at our website, look at the different calculators that we have there, look at the different webinars. There's such great tools on there, and it's in 15 different languages. And it's amazing. They have audios, they have Braille, they have it in any way. So if you were dozing off, this is what I'm going to suggest. And trust me, I don't blame you sometimes for dozing off during this stuff because it's pretty boring. But I'm going to tell you, if you want to really make a smart decision when to retire, you really want to look at all of this information in advance. Because in 32 years, it's broken my heart when I have told people for the first time what they're going to receive. You know, I mean, we go out, we take our time to pick out a nice suit, a nice dress, a nice where to eat. We spend a lot of time planning a vacation. Plan the best vacation of your life with a lot of time, your retirement. I see too many people not make it to retirement, unfortunately. And I have the widow or widower in front of me, completely devastated that their spouse never collected one Social Security check. And now they don't know where their documents are. They don't know what they're supposed to get. They're lost. Maybe one person in the home always took care of the bills, took care of the paperwork, knows where the documents are. Or a child is trying to help a parent who now, is ill and thought that they were going to be healthy when they retired and was going to know where everything is. Put everything in a safe place with all your information, all the names of your spouses, date, while you can still remember them, date of birth, date of marriage, where they were married, okay? Marriage certificate, birth certificate, all this stuff to make things easier for you later on. But please check out socialsecurity.gov. I really, really hope that you do. Create an account and check out our website that has all these great tools. I am having a hard time with this thing. See this little block up here, FAQs? That's called Frequently Asked Questions. Now, before you go home and say, my God, I couldn't remember, or I couldn't understand a word she was saying. She's got that crazy Rhode Island accent, or I don't know what the heck kind of accent it was, but I couldn't understand half of what she was saying. That's okay, you're still all right. You're going to go on socialsecurity.gov and you can click on Frequently Asked Questions, and you can type in what your question is right here, okay? And you can type it in and it will give you a million answers. It will help you unbelievable. It's one of the most popular things that we have going. Now, before I forget, I want to ask you all, do you know where your Social Security card is? All right. This is a big problem in Rhode Island lately, and it's driving me pretty crazy. It might force me to retire myself. I don't know, because when you go to the DMV, I guess you have to show them your Social Security card and things like that, right? But a lot of people don't have it or lost it. And before, the local offices, you would come in, would do a new application, would give you a receipt, and would give you a letter with proof of your Social Security number, and you'd go back to the DMV to get what you needed. Now, we are no longer going to be doing that. So, we are no longer going to be giving out those letters. So if you lost your Social Security card and you have to go somewhere that you have to show it, apply for it in the office, get the application right from our website, and you would have to show an ID. It has to be an original document ID, can't be a photocopy, and then go to the place, because we are no longer going to be doing that, giving those proofs out. There's a lot of information on that. It has a person's social, their parents' information, a lot of stuff. So we have to be careful. And plus, in the Providence office, that's where my home base is, but I really cover Rhode Island, Massachusetts, and parts of Connecticut. I can't get this to get bigger. Yeah, I can't get it to get bigger, but I'm sorry. On socialsecurity.gov, if you scroll all the way to the bottom, you're going to see that we have webinars. We're on Facebook. We're on, all people are writing in questions. In Providence alone, on a daily basis, we see over 500 people a day that come in. That's not the claims we take over the internet or the claims we do over the phone. So I highly suggest, if you want to see someone before you retire and get all your facts together, know whether if you are contemplating a divorce and you've only been married 9 years, 9 months, stick it out for 3 more months, okay? Try to stick, you know that you have to try to stick it out for 3 more months, because Natalie Sorsby told me I had to be married for at least how long? 10 years. So you would make an appointment, okay, to go in to find out what you would get under your own record, what you could collect possibly as a spouse, what you could possibly collect if you were contemplating a divorce, or if you were contemplating death. No. But I do get these calls. I do get these calls. We get the death certificate, and then there's a little line that says cause of death. If in that line it says suspicious, okay, and we're waiting for the decision, what actually happened, if it's under investigation, and you might be a prime suspect, we cannot pay you those spouse's benefits until it's resolved. Okay? Now, on our website, like I said, it also has how you can contact us, and we determine all your information of what office you should go to based on your zip code. And what's wonderful about this part is that you just put in, give me a zip code, anybody. It will give you the name, the number of your local office, tell you our hours. Did you notice our hours have changed? We close at 3, and on Wednesdays we close at noon. But what I like about this, people think the Social Security office is that we're also / telephone operators. When I help on the phones, answer that crazy phone that I hear in my sleep, I answer a lot of calls. I go, Social Security office, Mrs. Sorsby, can I help you? Could you please give me the number of the unemployment office? Well, I guess. Could you please give me the number of the senior center in Narragansett? Could you please give me the SHIP counselors in Rhode Island? So what we have here on our website is we have put down, based on zip code, other agencies that we get phone calls. Notice suicide prevention is right on the top. So these are all the numbers in your area. Notice suicide is right on the top. One of the most craziest claims I ever took in my career, a gentleman had passed away unexpectedly. It was in an automobile accident. His wife comes in to file for widow's benefits, and they have 3 minor children. So I did the application for her children because she wasn't 60 years old and she wanted to continue to work, okay? But I processed the claim, off she went. The children were going to get the checks direct deposited, and it was going to be in the mother's name for the children, right? Now, the next day I go in and I call in my interview, and the person says they were here because Mr. So-and-so passed away and they have 3 children from this person. And I went and I brought it up and I'm like, yeah, this all sounds familiar to me because I did the claim before, the day before, for the widower. Now, those 3 children, they had proof, she had proof that those children were that gentleman's children who passed away. Now I have to contact the widower and let her know that the checks coming for her own children have to be reduced. Because we determined that amount based on 3 children, right? Now we have to determine it based on 6. Needless to say, when she got my lovely letter, I decided not to call her that night. I figured, let her get the letter. She got the letter, she came in, she was very upset to find out that her spouse had 3 other children out there, and now that her children were going to get their checks a lot less. So be careful, know how many children are out there, what benefits you can receive. But again, all this information's there. Just 1 second before I forget. I mentioned to you that you'll be notified a few months before you turn 65, right? If you want to get Medicare. But if you're already 65 when you come in, you might say yes or no, whatever. But if you don't want to collect a cash payment, you want to wait till you're 67 or age 70 because you have other savings or investments, right? You want the highest amount possible. You can file for Medicare only at 65. And where would we get that premium from? You would be billed every 3 months for it, okay? So don't think that you have to collect a cash payment and to get your Medicare. You don't. You don't, because there are a lot of people that don't want their Social Security benefit at 62. Folks, I've had a project where I've had to go see centenarians in the last 3 months. Been pretty interesting. And they love to tell me how they got their money's worth from Social Security. Now, you guys know what a centenarian is, right? A person who is at least 100 years old. So every area had a list, and in the Warwick area there was quite a few actually, but I have to see them face to face, or at least feel very confident that I know who I'm speaking to on the phone to verify that they are what? Alive. Because guess what? Some people die and the spouse just decides to keep collecting the check and not report the death. Now, 90% of the time we do get notified is by the funeral home. But I called a lady the other day and I asked for her husband, and she said, he's been gone a while. I said, do you know when he's going to come back? She says, I don't know. I don't expect him coming back today. I said, well, I was like, okay, well, I really need to speak to him. She goes, well, I don't think that's going to be possible. And I said, well, ma'am, does he have a hard time communicating? She says, yes, definitely. And I said, well, I have to verify, ma'am, that he's alive. She goes, oh, that's all you had to say, dear. He's definitely not alive. I said, oh, goodness, no, because now this woman is in very big trouble. So we have to involve our Office of Inspector General. Of course, the person's been collecting a lot of money for years that they weren't entitled to. So it's a big problem. So we always try to we work hard to keep the integrity of our programs the way they're supposed to be and pay payments to who's entitled to them. Another special project we had recently, and this is why we want you to use the internet, because they have me going to all these crazy places. I can't be on the phone. I had to see and check if somebody was alive if they haven't used their Medicare in 3 years. We had a list come up for people who haven't used their Medicare in 3 years. Now, why wouldn't you use your Medicare in 3 years? Either you're very healthy and you haven't had to, which that's happened. And I love when they tell me, oh, honey, I'm fine, I haven't had to go. Or they're out of the country. Now, if you are not a U.S. citizen and you leave this country, and you're going to be out for an extended period of time, you have to report that to Social Security because you're charged an alien tax. And number 2, Medicare B is no good out there for you. So you've been paying. Now, some people with very good intentions thought they were leaving for a month, got ill, and now have been out there for a while. Now, I can't prove that they're alive out there, right? For all I know, it could be a weekend at Bernie's, and the person is put somewhere, and they're getting their benefit, and they're not entitled to it. The bottom line is, the embassy out there, wherever country they're in, we would contact them to make sure that the person is alive. So see, there's a lot of things involved. So please, tell your family members when they want to go to Social Security, make an appointment, create a MySSA account, all right? And if you had a bad experience, if you don't feel comfortable with the person you're with, ask to speak to someone else. Now, this was just retirement, spouses, divorced, widows. I could talk to you a half hour about disability if anybody ever became disabled, but I won't because I was asked to talk about retirement, spouses, and widows. So there's a lot more things out there that you should know about and that your children should know about. The concept of young adults knowing that they have to save hasn't really come through yet. So they have to see what Social Security will only provide, all right? So I hope you got something out of it. I am going to be here at the end of this session. If somebody wants to come over to see me with a personal question, I will be here to answer all your questions. Thank you so very much.
Terrific, thank you. Remind you again, there's an evaluation form in here. We really would like you to fill it out and hand it in. Some of you I see may be leaving. And the final leg of this retirement is, of course, your 403B account. You can have, as you know, TIAA CREF.
100% of your current income, through retirement, but let's look at if we reduced it by 10% during retirement. These are the scenarios that we will look at for you. We will work with you to figure out what it is that what you can achieve during retirement. You may say, I have these IRAs, I have some Roth IRAs. I look at them and say, well, where do you think you're going to draw from? Most people don't know how they're going to draw down on these accounts. This is what we help you with. And many times we will recommend consolidating your accounts. For folks, just so you know, you do have the ability to consolidate into your TIAA CREF plans. If you have outside IRAs, other plans, we can consolidate. Again, things to consider: providing for your spouse or partner, your health and your partner's health, emergency cash. We always want to calculate in emergency cash. And then, so any threats to retirement income. So we need to look at all these factors, whether you have a partner that might be very ill. We need to take these things into consideration. Special needs family members. We look at that. We look at estate planning. We help you with a lot of different things during retirement. Things that can impact your retirement: outliving your assets, the loss of purchasing power, and the returns lower than anticipated. So outliving your assets, again, this is what we help you with, as far as creating a spreadsheet for you, looking at everything through age 95. Loss of purchasing power. How are your investments, how is your money invested? If you are, again, we go through a risk tolerance with you. We look at, are you a conservative investor? Are you someone who might be moderate? We ask you several questions to figure out what type of risk you're willing to take on. Means you still need to look at some of your options on being able to stay ahead of inflation. And again, we need to take into consideration returns lower than anticipated. So there's a lot of factors that come up year after year that, your accounts may dip, they may do fabulous like last year, but again, we need to take everything into consideration for the long haul. That one year that we might have a bad year, again, I say, are you in good health? Do you think you're still going to be collecting, retirement income for the next 15, 20 years? That's what we need to be looking at. So when we look at your income and how long it should last. So if you retire at age 60, we figure in at least 30 years for women and 27 years for men. And I know that there are a lot of jokes around that, but I'm not going to go there. The same thing, age 65. We figure life expectancy for women, at least 26 more years during retirement, and 23 for men. And at age 70, 21 years. So if you retire at age 70, again, we want to make sure your assets last for a long time. And many of you have legacies that you would like to plan for, leaving it to children, leaving it to grandchildren. These are things we take into consideration. So again, any assets that might be left at the end, we can help kind of estimate what might be left based on the income that you're drawing on during retirement and any sort of legacy planning that you would like to take into consideration. Charities. We have many folks that want to leave monies to charities, so we help you with a lot of that planning as well. So when we talk about purchasing power, we talk about the different markets, the stock market, the bond market. We look at average annual returns. We need to take into consideration, again, how you're invested. So if inflation's at almost 3%, and you've got US Treasury bonds at 3.58%, it's not going to, it's just going to stay at inflation. You're not going to have the purchasing power. When we look at adding in other types of investments into your portfolio, corporate bonds, real estate, large company stocks, having a piece of that in your portfolio can be very important for the long haul. So now after taxes, you know, when we take a look at what happens with inflation, and then once the taxes are taken out, because as we know, your retirement assets have not been taxed yet. They are going to be taxed as they come out. So after taxes, now you also have to take into consideration what's your real return. So again, important piece is your overall asset allocation in your retirement plans. Like I mentioned, you've got investments that influence the asset balances and income streams. You need to be comfortable with the amount of risk that's in your portfolio. That is why we go through a questionnaire with you. We are not going to recommend, or any advisor is not going to recommend an investment or a portfolio that is an aggressive portfolio if you say to us, well, I'm conservative or I'm moderately conservative. We need to take that into consideration, and that's how we're going to guide you with your overall portfolio. And again, we look at that and how is that going to sustain you through retirement. So if you are with TIAA CREF, we have a lot of options for you, and that's why it's important to talk to someone. Because everyone is different. Everyone's needs are different. We have lifetime annuities where you can annuitize your contracts. You can take just a systematic withdrawal. So if you said, you know what, I just want to take X amount of income every year, we can just do a systematic withdrawal out of your portfolios and draw down that way. You can take interest only. I see many folks initially taking interest only. You also can do an annuity that's just a fixed period of time, that's not a lifetime. So sometimes I'll have folks that'll take a portion of their assets, and for one reason or another, they might be trying to bridge a period of time and say, you know what, I'd love a fixed period of, say, 5 years. I'd like to annuitize a portion of my assets for the next 5 years. I need, you know, $3,000 a month. We can do fixed period annuities. And then at age 70 and a half, if you are retired, you have to start drawing at 70 and a half the minimum distribution. If you are 70 and a half and you're still working, you do not have to do that.
Minimum distribution from what? From the 401k?
From your retirement accounts except Roth. So your TIAA CREF, yeah.
Does it have to be the percentage from each of the accounts, or can you take it all out of one account based on the total?
You can take it you can take it from one. What we recommend, and I'll get into that a little bit more on that required minimum distribution in just a second. If you have IRAs and you have a 403B, you have to take a distribution from each. And this is why we talk about consolidation, and we talk about making it simpler for distribution purposes, as well as looking at your overall asset allocation. Many folks that I've run into have worked at many different institutions, and you may have contracts. It could be from Ohio State, it could be from UNC. One thing to think about is actually consolidating contracts, and you have the option to do that and making it simpler when the time comes to draw down on it. So, but we'll get into the required minimum distribution in a little bit here. Your lifetime, oh, I'm sorry, go ahead, Lynn.
Although I've been working, I've had to take a minimum distribution, a small minimum distribution. Is that because of an account from a different institution?
Correct. Right. So you don't have to take it from your account.
From here at URI.
Right, as long as it's here, the one that you're currently contributing to, you don't have to. But if you're from the other school, you will. That's why consolidating would eliminate that.
It depends on your age too, and where the money is.
Right. So
Like if you had IRAs at Merrill Lynch or something, and you're at, you know, you're past.
that is correct. Yes, that is correct.
Transfer it over to TIAA CREF.
You can defer it.
No, you defer it before you retire.
Yes, you can. You can consolidate.
You have to take it out.
No, oh, no.
Yeah.
That's the way it works.
But do you consolidate, when you talk about consolidation, so let's say there's that Merrill Lynch IRA.
Right.
And if it goes to, and say that's 50,000 in there, and
Yep.
say there's 100,000 at
Yep.
CREF. So now you have 150. Do you in fact have to withdraw less money if it's consolidated than if it were in two separate? Or is that withdrawal rate based on the total amount?
It's based on total amount and your age.
Okay, so it's not just consolidating that lessens the amount.
No, consolidating helps defer. So for instance, if you're still working.
Oh, if you're still working.
Right. If you're still, right. So if you're still working, right, at 70 and a half, by consolidating any other retirement accounts into the TIAA CREF account that you're contributing to now, because what happens is you've got this salary, and now you also, the government's making you take money out that you don't need to take, and you're paying taxes on it. You have the ability to defer it up until retirement. So just going back to some of the options, the lifetime annuities, again, you have the ability to take some or all of your TIAA CREF or annuities, your RA, GSRA, 457, and annuitize it for life. So I'll give you an example. I have a client who is 95 and her husband was the participant, and they decided to totally annuitize their assets many years ago to get their guaranteed set dollar amount every single month. And I will tell you, similar to Social Security, she has gotten her money plus some. Even if that pot of money runs out, you continue to get a payment.
Let's say you do that and then you die like 2 years later, what happens to the rest of the money?
You can actually have a period certain put on it to where your beneficiaries would get the remainder of the and I'm going to get to that in just a second. Yep. And that's why I recommend not only annuitizing what you need to, and not many people actually annuitize, so, yeah.
I don't know if you're going to get to it, but there's that chart on page 9 of this booklet, and it's not clear to me what those numbers represent.
I don't have the booklet in front of me. Do you have the booklet?
You add up all the numbers across to get whatever the monthly income is? Or?
I'll tell you in just a second once I get the booklet. I'll answer your question once I, oh, okay. Okay, all right, so you know what? It's a sample of where you can draw your assets from.
I
Yeah.
understand that, but what I don't understand is, it says here monthly annual annuity income, and it's based on essentially 200,000, I guess 100,000.
Right, on one life and then two life.
And then you can pick what you want, but
Right.
does that
Yes.
mean that you add up
Yes.
all these numbers?
Yes,
across?
based on that dollar amount,
And that would be the monthly.
correct. So again, kind of going back to the lifetime annuities, you can do it on one life, your own, or you can do it on joint life. So for instance, you know, your partner who may maybe worked, maybe there's just not a lot of, the Social Security isn't going to cut it. You can do a 2-life. And we can do these illustrations for you. I've been doing them a lot lately for folks that are thinking of retiring in the spring. We can actually run illustrations for you. And looking at the 1-life, just single life, joint life, and period certain. So the period certain would be, just say you wanted to have a 10-year certain. You said, all right, I'm going to do a life annuity with a period certain of 10 years. If something happened to you in year 2, the remaining payments for those next 8 years go to your beneficiary.
And after 10 years, then what?
Then it stops.
So then the money stays with TIAA, correct?
Correct. Yeah. And that's why some people may opt to just do a very small portion annuitized, but many times people just take a systematic withdrawal. It's much more flexible. And those payments will go, the remaining assets will go to the beneficiaries. Yeah.
Thank you.
Speaking of beneficiaries, the one thing you always want to make sure of is make sure your beneficiary information is up to date on your accounts. Very important. You may have done it years ago, but you can do it online. It's just will save a lot of heartache. You may say, well, it's in my will. I will tell you that all retirement accounts, the beneficiary information on retirement accounts supersedes anything. Wills, trusts, so it's what we have on file for beneficiary information. And it's not just us, any IRAs or annuities elsewhere.
Would probate too, if you have a beneficiary, does that have to go to probate?
No, nope, no probate. And in that booklet, this is kind of where this goes with the fixed and the variable. And when we do some calculations for you on annuitizing your contracts, it will depend on how much money you have in your TIAA traditional and the variable, and whether it's with us or any other firm, whether it's a MetLife contract, they all take this into consideration. The calculations are based on, like say, your CREF portion and then your TIAA fixed portion. I don't see a lot of this. It's what we call the retirement transition benefit. It's a cash payout of up to 10% the first year. I will tell you, 99% of the time when I meet with clients, it's okay, I am retiring, I'm getting my last check in July, I need to start my guarantee, some sort of a income stream starting in August. What are we going to do? We look at what you need. We look at it, like I said, we like to create a nice retirement plan for you and say, okay, you want X amount of dollars going into your checking account. We withhold the taxes for you. We send you a statement for tax purposes at the end of the year or the beginning of the following year. But that's typically how we do it, is just kind of replace that salary that you haven't been getting and just creating that income for you going forward.
So that means that you don't need to file, we don't need to file quarterly taxes then?
No, we'll withhold it and then submit it for you, absolutely. Mm-hmm.
Can I just mention something?
Sure.
I just want to mention something at this point right now. One thing you have to keep in mind, when you are going to receive Medicare, anybody with higher incomes, okay, the base premium does not necessarily stay at that $104.90, okay? So, for example, it's a 2-year look back, so that how we determine if it's going to have to be a surcharge on top of that $104.90. It's a 2-year look back. For an individual with a modified adjusted gross income of $85,000 or less, it would be the $104.90. But anything higher than that, there's a surcharge on top of that $104.90. Now couples, it's $170,000 or less. So for example, if you were drawing and now 2 years later, your modified adjusted gross income was higher than those specific amounts allowed to you, you're not gonna just pay that regular monthly premium. So you may wanna think about that and say, well, you know, if I took a little bit more, if I don't take a little bit more, it ain't gonna put me over the surcharge. Those are things that we've met with financial planners and groups to mention to their clients, because a lot of times they'll come in and say to us, well, gee, if I had known that, I wouldn't have withdrawn that, it wouldn't have put me over the amount for the Medicare. So just keep that in mind when you make your decisions.
Can you give an estimate of what the surcharge is?
Sure, and it is on our website, under that frequently asked question, you can just type higher income, monthly Medicare premiums for higher incomes. For an example, it would be like another $42 added on, and sometimes another $167 depending on the income. So there's a graph, a month
For each
for
person.
each person. So it's really important, because you would get a letter in the mail saying that now your Medicare premium is going to be a lot higher. And it's a 2-year look back. Or if like somebody unexpectedly, again, becomes widowed and inherits different things to increase their modified adjusted gross income, that would affect the Medicare premium. So something to keep in mind.
And to Natalie's point, I did just run into this with one of my clients who retired, but also received an additional lump sum payout. And so we want to make sure that we're figuring everything in from a tax standpoint. We don't give tax advice, but these are things that we need to think of, especially during that first year of retirement. So if you're getting, your paycheck stops, you're getting a lump sum. Oh, and by the way, if you're 70 and a half, we need to start figuring that in as well. So there are a lot of factors that we have to take into consideration, especially when you first go to retire, you know, and we want to plan it accordingly.
Take out taxes from Social Security, if you want to tell them that.
What's that?
You can take out taxes from Social Security, you can determine so much
Oh.
a month.
Okay, so,
They can sign a form. You could sign a form having so many taxes taken out, certain percentage from your
Social Security
check.
withheld,
You can
yep.
also do that in
Is that
advance.
form online too?
Yes, it is.
And, but you can adjust that later if you want to, right?
You start off one percentage for a couple of years, and then you decide to change it, you could just submit a new form and we would change it, but you can take out taxes from your Social Security in advance.
And that's the same thing through us. If you know, that first year, again, everybody's situation is going to be different. Sometimes we want to withhold possibly a little bit more that first year. Yep.
Yeah, I went on your website and I was a little bit confused in your PowerPoint slide, suggesting that there may be some questions in my mind as to what goes on. You talk about the availability to pay traditional, being 10 annual installments.
Yeah.
Is that 10 annual installments that are payout, or can they be transferred to other asset classes?
They can be transferred to other, so it can be transferred to CREF. Or, you know,
Right.
yes, absolutely.
You can do that,
Yes,
but it must be in 10 annual installments.
correct. Yeah, on that TIAA traditional, it is,
Could you use that as your retirement monies instead of transferring it to the?
oh, sure. Some people just will use the traditional as their income source for, and let the others grow. Absolutely. Yeah.
If you're already doing the 10 installments and you've been moving your money around, are these 10 additional installments once you retire? If you're doing something now prior to retirement?
Are you doing the 10 installments now?
Correct. Is that 10 total or 10 before and 10 after retirement?
That 10 is, that's based on retirement income. If you're doing that now, are you receiving it?
No, just moving around.
Just moving it around, okay. Then this would be, yeah. That. And again, that 10 payments just pertains to the traditional side, your guaranteed side only.
And if you put it in CREF, you don't have a tax.
If you put it in, right, as long as it's transferred within the plan, there's no tax implication, correct?
Could you just say that again, if you move something
From the TIAA traditional side to CREF, there's no tax implication because it's still within the plan. a lot of people will start to do the, start to free up. Now, there have been some myths about the traditional, that if something happens to you, your beneficiaries don't get it. They get it. And on top of that, it becomes liquid. So anybody who inherits a TIA traditional, those funds are now liquid, but they've still maintained the interest rate. So
But they're taxable.
it will stay, no, because it'll still stay in an IRA for them. And what will happen is, yeah. So again, kind of talking about how to withdraw it, that's something that you really want to talk through with someone with TIAA CREF. When you know, I brought up having residual assets later on upon death, how do you want those monies to be distributed? Is it just going to your beneficiary? Do you have charities? Whatever it may be, it's something to be talking about. Tax implications on lump sum withdrawals. Oops, sorry about that. Again, something that we need to talk about when that first happens. We can change your income anytime. We can move it up, we can move it down. What we can't change is your required minimum distribution. But the key is being able to really understand how you're going to be drawing down on this. I've had clients come to me and they may have 5 or 6 different retirement accounts. And again, what is going to be the most efficient way of drawing down, not just on retirement accounts, but you may have assets outside of retirement accounts, and we are going to guide you on where to draw that income most efficiently. Because if you think about it, your after-tax money will come into play as far as income drawdown.
Is the required minimum distribution, is that a percentage?
Yes, it is.
But is it based on?
It's based on your age. It's based on your age and the year-end balance, 12/31 of the prior year. So anyone taking a distribution this year, it's based on their balances, 12/31/13, and then there is a number.
When you say based on the balance will also reflect the percentage as well as the total amount?
The percentage is set by the IRS. So say the first year, I believe it's 27.4 is the divisor. 27.4 divided by your year-end balance in your retirement account will determine what your required minimum distribution is.
So if the accounts are high because of good stock whatevers, in say 2013, and then there's a crash, you still have to take out a lot of money based on the previous good year.
Yeah, that's
Right.
Yeah, okay.
Right. And the divisor changes each year based on your age. Again, it's because the government says you've accumulated all these assets all these years and you haven't paid any taxes on them. So now we want you to start drawing down in just knowing those benefits, the Medicare, all these things that come into play, as well as estate planning. We will guide you on that as well. We don't write documents. We have attorneys we work with that we recommend, but we will review documents for you. So there are a lot of aspects that we at TIAA CREF will do for you on that whole planning piece. Again, talking about consolidation, it just makes record keeping easier. It also, the thing to think about is it's not just for you, it's for the folks that may have to deal with your estate later on, and that they don't have to go to looking at 5 different institutions of how am I going to do this? Where is everything? This is a way of making it right for them as well. So again, I'll be here. You know, this has been a pleasure, and again, good luck.
If you, one thing, first of all, fill out your evaluations, and if you could stay for another 5 minutes. Natalie wants to address something.
I want to mention something that I touched base on. Yeah. 65, you all know that, right? Or if you have end-stage renal disease, you can apply for Medicare. But I want you to understand something, and this is something that I really hope you will share with other people because, again, I get many of these phone calls and I see so many times people not get benefits when they should be collecting. If you want to file for Social Security disability and you become approved for Social Security disability, you do not get your Medicare until 2.5 years later. Because if I came down with a terminal illness today, God forbid, and I filed for Social Security disability, as an adult, I would have to have worked at least 5 out of the last 10 years under Social Security to be able to even file, okay? It's nothing to do with those 40 quarters or anything like that. But if I was approved, there's a 5-month waiting period before they could even pay me under Social Security. And then there's another 24 months before I would get the Medicare. Now, what's happened, how many people here in this room know people that go to work ill, sick? They're trying to stick it out, right? Till 62. I know a lot of people like that in my family, friends, and you know, they're like, I'm just trying to get to 62 to retire. But what if one day you're told you can't come in anymore? The company closes or your position's eliminated, things like that happen, right? And you wanted to stick it out. But your employer knew that you had these health problems and was working along with you. Now you're having a hard time finding a job because of your health problems. Now if you're 62, you're fortunate enough to file for that retirement, right? But I want you to realize that you can file for retirement and disability at the same time. What we would do is we would pay you the retirement at 62 or whatever, okay? And we would do a disability application at the same time. If the disability comes back that you were approved, and it has to be a condition that's expected to last a year or more or result in death, we would change that rate that you were getting deposited to the higher rate, to your full retirement age rate. So you don't have that low rate anymore. So it's something to keep in mind. Also, if someone is collecting or TDI or workers' comp and they are disabled, they don't have to wait until it's done to file for disability. That happens too often. People come in, when did you become disabled? I've been disabled, I've been home now for 2 years. I've been home now for a year. What have you been living on? My workers' comp, my TDI. I was told I had to be home for a year before I could file. Please, that's not true, okay? So just keep that in mind. I don't like the 5-month waiting period. It really bothers me because, you know, and I know I'm not supposed to say this, it's not the politically correct thing. I think you guys will keep a secret, right? But the thing is, if I'm terminally ill today and I worked all my life, I feel that I need my benefit. I don't want to have to wait 5 months to get my check. And I surely don't want to wait another 24 months to get my Medicare. But these are things that you should know, that you can talk to your politicians about if you wanted changes, you know. You didn't hear this from me, that I don't like it. But again, you don't things until it happens to you. So again, just keep that in mind. If you know of anybody in those circumstances that you know is struggling, having a hard time, lost a job, is ill, just living on a small retirement, find out if they should check it out to see if they could get disability. All right? Thank you so much.
Thank you all. I'll collect your evaluation.
Thank you.
Where is the sheet? It's in your folder. Told you 3 times.